is it ADHD? Where's the PTSD kind of plays a role in it. Like once they do their little magic math numbers that I can't do, they still noted that women who self-reported perimenopause had worse symptoms when they were ADHD. That was a very backwards way of saying that, I'm sorry. But it was a little bit lower. Like the association wasn't quite as strong when PTSD was not in the mix, I guess, does that make sense? So like it's finding where all that overlap fits. I feel like I'm very, very muddy in how I'm saying this. I'm sorry. Right. So they took like the subset of women that was what, 35 to 55 or something like that, right? That responded to the overall study, that group, age group. And then they pulled their ADHD screening and their perimenopause screening. And also they had asked them, are you in perimenopause or not? So when they looked at the individuals that had screened on the test for perimenopause versus the women that said they had perimenopause, then you started to see a little separation as well. But again, what I thought they did really well actually in this study was like, this was the limitation, right? When they did this, the only like perimenopause screener they had was answering questions, right? But some of those screeners are, is your anxiety getting worse? Is your depression getting worse? And that's all things that are also associated with that. There's also, I pulled up some other studies as well. So just an increase in anxiety and depression and reduction in executive function is also just a symptom of perimenopause. So are they, like it gets a little hairy, I guess it is. This study would have been a little bit stronger had they had done all of this and also tested like hormone levels or tracked periods, something like that.
Right.
But I don't know that that was the point of doing this either. So it's not necessarily like they did a bad job. I think they did a good job of saying what needs to be looked at more closely, right? That's why I told you that it's a starting point. I think it definitely shows a clear correlation. But then the other thought that I had is I have a woman who's 40 in front of me in nutrition counseling. Do I care if she has a reduction in executive function because of perimenopause or because she has ADHD? Like she has a reduction in executive functioning and we have to work with that. I don't think it matters so much why. I think that we get really in the weeds of that, of like having, it's something that I've often honestly thought, having worked in both veterinary and human medicine, that human medicine gets too caught up in like the exact specific thing. So like, for instance, during my fancy talk, one of the questions was, well, how do you treat gastroparesis differently if it's because of substance use? And I was like, well, but why? It's still gastroparesis. Like if the substance use is removed and it's the gastroparesis resolves, well, like, yay, that's how you treated it. But like if they still have gastroparesis or you have a patient that is still using the substances, then you treat it like gastroparesis, right? Like, so I think the same thing, like we need to figure out how the brain works in their counseling and like, okay, maybe this used to work, but you're not where you used to be, you're where you are now. And we still need to figure out what's going to make your brain function better regardless, right? Clarifying that I don't think is clinically that important to me with a client in front of me. I think it's super interesting, but I think we sometimes forget that super interesting does not translate to a difference in how you talk to your clients, right?